Okay, you guys ready to get going?
Yes.
Okay, so we're gonna have, this is mostly gonna be didactic today. We have maybe some time for some unknowns if we get to it. So the first thing that you guys are studying this week is nutritional deficiencies. Okay, so these are basically deficiencies of zinc. If you get a glucagon tumor, basically anything that essential amino acids, biotin, carboxylase deficiency, any of those all look the same. And basically you need those nutrients to get into your skin and make the epidermis normal and not basically have abnormal cornification. So it's very common we see a fully developed lesion in one of these. It's really florid and they're really erosive and they got a lot of inflammation or a lot of redness and scaling and crusting clinically. They get this characteristic ballooning degeneration of the upper part of the epidermis, just like this. Okay, so this is, remember, we have the three main types of intraepidermal vesiculation: spongiosis, acantholysis, and ballooning. Well, this is ballooning. And notice where the ballooning occurs. So just think in terms of like, here's the blood vessels and capillaries that are supplying the nutrients for the epidermis so it can grow normally. Well, if they don't have enough of those, it doesn't get through the full epidermis. And so just think of it as the top of it becomes abnormal and it gets this erosive ballooning degeneration with this parakeratosis. So clinically, it's flaky paint, pellagra-like morphology. So it's classic. Now, if you get a late stage lesion, like over here, where you don't really see a whole lot of the residual ballooning, it can look a lot like psoriasis. So a late stage lesion of this can be really subtle. Okay, so all these look histologically the same. There's about 5 or 6 of these, and you need to know which ones cause this pattern. So make sure you know all of those. Zinc deficiency, glucagonoma, necrolytic acral erythema, pellagra. So they all look the same. Okay, so you guys read that in your textbook, right? The lecture part?
Yes.
Yes.
Okay.
Yep.
All right, so that's the first one. So just fix that in your mind. So when I show you an unknown, you're going to get it. If I show you that on the Dermpath Bowl, you guys are going to get it, right?
Right.
It's just general nutritional deficiencies that we'd be able to say, or we'd like list all those differentials.
I'll give you the same morphology. Exactly right.
So
Okay.
any of them would be a right answer.
They wouldn't ask you, they probably have like a choice, and one of them would be a nutritional deficiency, and the other would be something like irritant dermatitis or spongiotic dermatitis or something like that.
Okay.
Okay, so here we've got another nutritional endocrine problem. And notice there's no inflammation here. No inflammation. So what am I showing you here at high magnification? It's all that pale, slightly bluish gray material in here. That's present diffusely in all the papillary dermis, going all the way down into the lower reticulum.
Mucin?
Yeah. So what's the diagnosis? What if I told you this was in somebody that had thyroid disease?
Myxedema?
Yeah, this is pretibial myxedema. So that's what it looks like when you get a biopsy of it. It just shows basically is diffuse collection of mucin throughout the dermis like this with no inflammation. It's not really an inflammatory disease. It's basically a deposit of mucin. It's probably not even really a true deposit. It's probably the LATS, long-acting thyroid stimulator, that is causing these fibroblasts and mast cells or whatever to produce hyaluronic acid in the dermis. So the same pathophysiologic process that causes this is what causes, exophthalmos. And now they've got a drug for that. So we probably should think about using it for this. Since it basically has the same exact histology, it's not really an inflammatory skin disease. It's basically a deposit. And it's not really and truly a deposit because they don't really have elevated circulating mucin levels. It's basically because they have low thyroid and have high thyroid stimulating factor, TSH and whatnot, that causes these cells to produce mucin. It's really analogous to a digital mucus cyst, where the fibroblasts produce the mucin, there's no cyst there. So somebody wants to do a little study. Let's give somebody that's got pre-tibial myxedema that same drug now they're using for the exophthalmos. Okay. We don't have a lot of stuff in the endocrine metabolic chapter this month, because I guess there really aren't a lot of them in there. They probably could have put some more in there. So what do we see here? What's the main thing we're looking at here?
Papillomatosis?
Yeah, good. And it's mostly epidermal papillomatosis. I mean, there's nothing in the dermis. This is purely an epidermal process. It's a punch biopsy. This was not a papule. So if you just saw this alone, a shave, you'd probably say, oh, it looks like a seborrheic keratosis. That's because it's epidermal hyperplasia, papillomatosis. You can see an epidermal, seborrheic keratosis or stucco keratosis. But this came from a large plaque on somebody's neck, and it looked like velvet, brown velvet. So what's
Acanthosis nigricans.
good? So that's associated with several endocrine diseases, right? Or several different conditions. What diseases are associated with acanthosis nigricans?
Diabetes.
Yeah, diabetes. You see it in patients that have insulin resistance.
Yep.
Like the obesity commonly goes along with that. It's often type 2 diabetes as opposed to type 1 diabetes. You can also see it as a perineoplastic process too, right?
Yeah, like the cancers.
Yeah, GI cancer especially. Now, the other epidermal acanthotic processes can look pretty similar to this. So if you didn't have any history, you could also look very much like confluent reticulated papillomatosis and, Golgi disease, although that gives you acantholysis, Dowling-Dego's disease. Those all kind of look the same. So there's a family of these epidermal reticulated processes that look like this that you at least to know what those are, because they all look pretty similar. Okay. So this time it happened to be acanthosis nigricans.